This doctor, William Bosworth Castle, fed his patients beef that he had eaten and regurgitated earlier that day. Patients were suffering from a type of anemia called pernicious anemia. Anemia is a lack of healthy red blood cells. Pernicious anemia is a type of anemia we now know is caused by a lack of vitamin B12. In 1926, when a young Dr. Castle stepped onto the scene, it was killing about 6,000 people in the United States every year. The only available treatment at the time was feeding the patients raw liver. I didn't know why it worked, but a 1920 study with anemic dogs had found that eating raw liver and practically nothing else helped them regenerate more red blood cells. So Dr. Castle is pondering the liver treatment and the fact that patients with pernicious anemia also have a lack of hydrochloric acid in their stomachs. So he comes up with an experiment. The first step of the experiment, he fed his patients 200 grams of rare hamburger for 10 days. When that didn't get their red blood cell count up, he moved to the step I mentioned in the hook. He ate a similar amount of raw beef himself and let it partially digest for an hour before bringing it back up. He then concentrated, liquefied, and strained the upchucked beef, and he delivered it to the patient's stomachs with a straw through their nose. Dr. Castle thought that any objection they would have to it would be aesthetic and not biological. So they didn't tell him what was in the straw that they were nose-hose feeding him. But on the 6th day, they noticed an increase in red blood cells, and the progress continued throughout the experiment. He was stoked and hypothesized that there was something in his own gut juices that he called the intrinsic factor that patients weren't producing themselves. It took 2 more decades of research for doctors to figure out that his intrinsic factor was a type of protein produced in stomach cells of healthy patients. And without that protein, patients with pernicious anemia can't absorb B12. People who make the protein absorb about 70% of B12 consumed, but without it, they only absorb about 2%. That's why liver was somewhat effective, because liver is absolutely chock full of B12. Nowadays, pernicious anemia still isn't curable, but patients are given regular B12 injections, and it's rarely fatal.